Box breathing, also called square breathing, is a structured breathing technique built around 4 equal parts. Inhale, hold, exhale, and hold again. The most common rhythm is 4 seconds for each step, forming a mental box. Cleveland Clinic describes box breathing as a simple breath regulation practice that can help lower stress and promote relaxation. Step 1. Sit or lie down comfortably. Find a quiet place. Sit upright in a chair with your feet on the floor, or lie down if you are practicing before sleep. Relax your shoulders, soften your jaw, and let your hands rest naturally. Step 2. Inhale for 4 seconds. Breathe in slowly through your nose for a count of 4. Let your belly expand gently rather than lifting your shoulders. Step 3. Hold for 4 seconds. Pause your breath gently for 4 seconds. Do not strain. This should feel controlled, not forced. Step 4. Exhale for 4 seconds. Slowly breathe out through your mouth or nose for 4 seconds. Imagine releasing tension with the breath. Step 5. Hold again for 4 seconds. Pause again for 4 seconds before beginning the next inhale. Step 6. Repeat for 2 to 5 minutes. Start with 3 to 5 rounds. As your comfort improves, practice for 5 to 10 minutes. If you feel dizzy, anxious, lightheaded, or uncomfortable, stop and breathe normally. Chapter 1. A simple breath that speaks to the nervous system. Imagine a stressful morning. Your phone is buzzing, emails are piling up, traffic is moving slowly, and your mind is already racing before the day has truly begun. Your breathing becomes shallow, your shoulders tighten, your heart beats faster, then you pause. You inhale for 4 seconds. Hold, exhale, hold. Within a few rounds, your body begins receiving a different message. You are safe. That is the power of box breathing. It does not require equipment, a gym membership, or a perfect meditation room. It simply uses the breath as a doorway into the nervous system. Deep breathing practices can help activate the relaxation response, which is associated with slower breathing, lower blood pressure, and a greater sense of well-being. Chapter 2. Reduces stress and anxiety. One of the most recognized benefits of box breathing is stress reduction. When you are stressed, your sympathetic nervous system becomes more active. This is the fight or flight system that prepares the body to respond to danger. The problem is that modern stress often comes from deadlines, bills, conflict, noise, and uncertainty, not immediate physical danger. The body may react as if survival is at stake, even when you are sitting at your desk. Box breathing slows the breath and gives the mind a steady pattern to follow. This can reduce mental chaos and help the body shift toward parasympathetic activity, often called the rest and digest state. Cleveland Clinic notes that regulating the breath may reduce stress and may help lower cortisol and blood pressure. For anxiety, box breathing can be especially helpful because it interrupts the cycle of shallow breathing, racing thoughts, and physical tension. By counting the breath, the mind has something concrete to focus on. Instead of spiraling into what if, attention returns to inhale, hold, exhale, hold. Chapter 3. Sharpens mental focus. Box breathing is not only for relaxation, it can also sharpen focus. When the mind is scattered, the breath often becomes irregular. A steady breathing rhythm acts like a metronome for attention. Each count gives the brain a simple task. This can help reduce distractions and improve mental clarity before work, studying, public speaking, difficult conversations, or creative projects. Many people use box breathing before high-pressure moments because it provides a quick reset. The practice helps move the mind from reaction to response. Instead of being pulled by every thought, you create a pause. In that pause, focus becomes easier. Chapter 4 improves emotional regulation. Emotional regulation is the ability to feel emotions without being controlled by them. Box breathing supports this by creating space between a trigger and your response. For example, when anger rises, the body often reacts before the mind has time to think. The heart speeds up, breathing tightens, and muscles tense. Box breathing slows this process down. It gives your nervous system a chance to settle before you speak, decide, or act. Over time, regular practice may help you become more aware of early stress signals. a tight chest, clenched jaw, shallow breathing, or restless thoughts. This awareness is powerful. The sooner you notice stress, the sooner you can regulate it. Chapter 5. AIDS, Sleep, and Insomnia. Many people struggle with sleep not because they are physically awake, but because their nervous system is still alert. The body is in bed, but the mind is reviewing the day, worrying about tomorrow, or replaying old conversations. Box breathing can become a bedtime ritual. Its slow rhythm helps reduce stimulation and gives the mind a calm pattern to follow. Other slow breathing techniques, such as 4-7-8 breathing, are commonly used to calm the mind, decrease heart rate, and support sleep preparation. Try practicing box breathing for 5 minutes before bed. Keep the breath gentle. If 4 seconds feels too long, use a 3-3-3-3 rhythm. The goal is not performance. The goal is relaxation. Chapter 6. Lowers blood pressure and heart rate. Slow breathing may support cardiovascular relaxation by reducing sympathetic arousal and encouraging parasympathetic activity. Harvard Health notes that slow, deep breathing practiced regularly may help lower blood pressure, especially when used as part of a broader lifestyle approach. Box breathing may also help lower heart rate during moments of stress. When exhalation slows and the breath becomes controlled, the body receives signals associated with calm. This does not mean box breathing replaces blood pressure medication or medical treatment. It may be a supportive tool. People with hypertension, heart disease, fainting episodes, breathing disorders, or pregnancy should speak with a healthcare professional before beginning breath-holding practices. Chapter 7. Increases heart rate variability. Heart rate variability, or HRV, refers to the natural variation in time between heartbeats. Higher HRV is often associated with better adaptability, recovery, and autonomic nervous system balance. Breathing exercises have been shown in research to influence HRV, particularly by affecting autonomic regulation. A review on breathing exercises and cardiovascular measures found that breathing practices can improve heart rate variability in people with prehypertension and hypertension. Box breathing may support HRV by encouraging slow, rhythmic breathing. However, HRV is affected by many factors, including sleep, hydration, fitness, stress, alcohol, illness, and medications. Box breathing is best viewed as one supportive habit, not a magic solution. Chapter 8. Enhances lung function and breath awareness. Box breathing may help improve breathing awareness and control. Many people breathe shallowly into the upper chest, especially under stress. Over time, this can reinforce tension in the neck, shoulders, and chest. Practicing box breathing encourages slower, deeper breathing. It teaches you to notice how air moves through the body. This may help improve respiratory control, especially when paired with diaphragmatic breathing. For people with asthma, COPD, panic disorder, or other breathing-related conditions, box breathing should be practiced carefully and with medical guidance. Breath holds may not be appropriate for everyone. Chapter 9. Facilitates pain management. Pain is not only physical, it is also influenced by the nervous system, attention, emotion, and stress. When pain triggers fear or tension, the body may tighten, making discomfort feel worse. Slow breathing may help some people manage pain by calming the nervous system and shifting attention. Research on slow, deep breathing and pain suggests that breathing patterns may influence pain perception and vagal activity. Box breathing does not erase pain or treat the root cause of pain, but it may help people cope better with discomfort, especially when pain is worsened by stress, muscle tension, or anxiety. Chapter 10. When and how to use box breathing daily. Box breathing works best when practiced before you desperately need it. Think of it like training a calm response. Use it before a stressful meeting, after an argument, before sleep, during anxious moments, before public speaking, after exercise as a cool-down, during work breaks, before making an important decision. A simple daily routine. Morning, 3 minutes to begin calmly. Midday, 2 minutes to reset focus. Evening, 5 minutes before sleep. Chapter 11. Safety and who should be careful. Box breathing is generally safe for many people, but it is not ideal for everyone. Because it includes breath holding, some people may feel dizzy, lightheaded, or uncomfortable. Consult a healthcare professional before starting if you have high or low blood pressure, have heart disease or irregular heartbeat, have asthma, COPD or breathing difficulty, or are pregnant, have panic disorder or trauma-related symptoms, experience fainting or dizziness, have a serious medical condition, are recovering from surgery or illness. Stop immediately if you feel chest pain, severe dizziness, shortness of breath, tingling, panic or faintness. Box breathing should not replace professional care for anxiety disorders, insomnia, hypertension, chronic pain, or respiratory illness. It can be a helpful, supportive practice, but medical conditions deserve proper evaluation. Final thoughts: the breath as a bridge, back to balance. Box breathing is powerful because it is simple. In a world that constantly pulls attention outward, this practice brings you inward. 4 seconds in, 4 seconds still, 4 seconds out, 4 seconds still. It reminds the body that calm is not something you must chase. Sometimes it begins with one intentional breath. Used consistently, box breathing may help reduce stress, calm anxiety, improve focus, support emotional balance, encourage sleep, lower heart rate, support blood pressure management, improve HRV, strengthen breath awareness, and assist pain coping. But the greatest benefit may be this: box breathing gives you a tool you can carry everywhere. No equipment, no cost, no perfect setting, just your breath, your awareness, and a quiet return to yourself. If you find this video useful, please like and subscribe to our channel.